Hello, and welcome to the Housing and Services Resource Center's webinar, The Role of Transportation in Cross-Sector Collaborations, designed to improve housing stability. We know that you are going to learn a lot from the presenters today, and we've built in a variety of opportunities for you to be able to be active participants too. Thank you so much for joining us today. Next slide. My name is Lori Gerhardt, and I'm the Director of the Office of Interagency Innovations at the Administration for Community Living, an operating division within the U.S. Department of Health and Human Services. I will be serving as the facilitator for today's webinar, and it's a privilege to have so many of you here with us today. Your active involvement in this webinar is essential for us to have an engaging discussion. Next slide. Today, we'll go over first some welcome and housekeeping items, and then we'll be starting off by asking for your input in a Zoom poll. And next, we'll talk to some of the HSRC, or Housing and Service Resource Center, federal partners about how housing stability is impacted by transportation or no access to transportation. Then we will feature two examples of exciting partnerships, one in Arizona that combines paratransit, rideshare services, and fixed route buses to serve one underserved community, and one in King City, California, a House America partner that serves an also underserved, mostly Hispanic population in a largely rural area and with several transit programs and services. Following that, we will be joined by a representative from the Federal Transit Administration who will demonstrate how to use an online resource to find partners in your area. Finally, all of our presenters will be back at the end of the presentation for a panel question and answer segment. Next slide. But before we jump in, let's take care of a few housekeeping items. This meeting is being recorded. By staying to participate, you are consenting to the recording. Also, all attendees have been muted for audio quality. One hallmark of our webinars is active participation from the attendees. So please use the chat to make comments and talk with your fellow attendees. We will also prompt you to answer some questions in the chat later in the webinar. For questions, please submit those at any time using the Q&A feature in the Zoom dashboard. We'll do our best to respond to all the questions that we receive, and those that we're unable to respond to today, we'll get back to you with a questions and a frequently asked questions document. We're unable to respond to raised hands, so please use the Q&A function to ask questions. If you have comments or questions at any time during or after the webinar, you can email us at hsrc@acl.hhs.gov. You can also use the chat or email if you have technical issues. Next slide. So now let's get into the poll. We're curious to learn who is being represented here today. Would you please respond to this short poll? How would you describe your group or organization's current role in providing transportation support to increase access to community services and ensure housing stability? The options are: provide direct transportation support, partner with a transportation provider, do not currently provide support but may in the future, or it's not applicable to our community. Thank you for responding. So if we can move on to the next slide, while you're responding to the poll, I'd like to tell you about the HSRC, or Housing and Services Resource Center, which stems from a partnership between ACL and other Health and Human Services, or HHS, department agencies, and the Department of Housing and Urban Development, or HUD, HUD. In every state and community, there are a number of entities and programs that help people access housing and supportive services. Often, the housing systems and the service systems are siloed or not connected. Stronger collaborations between these systems would enable more older adults, people with disabilities, and people experiencing homelessness to achieve housing stability, live with dignity and independence in the community, and avoid homelessness and costly institutional care. so people with disabilities and older adults can stay stably housed, healthy, and engaged in their communities. The Housing and Services Resource Center provides technical assistance across the federal agencies to cultivate cross-sector partnerships that bring together housing, homelessness services, disability services, aging services, health, including physical, behavioral, and mental health services, and transportation, one of our partners here today. After the webinar, I hope you will look at the HSRC website at acl.gov/, all spelled out, housing and services at the end of the webinar. We'll also share our email address again in the chat so you can be in touch with us and get periodic updates. Next slide. Let's close the poll. And we'll see, and while we're getting the poll results, please enter your name and the organization you're from in the chat. That helps us know who's attending today, and it lets the other partners know too who's on the call. So let's see, it looks like partner with transportation providers, 37% of you are already partnering. That's great to hear. And then the next, many of you, it's not applicable right now. And 19% do not currently provide support, but may in the future, and 17% are providing direct transportation support. Well, hopefully we can continue to build these numbers out after our webinar today and increase those partnerships. Okay. For those of you that have a transportation partner or are the transportation partner, please place your agency's name and the name of your transportation partner in the chat box. This will also help us identify where we have partnerships across the country. And often we've found from the technical assistance that we provide that the peer-to-peer training is often received the best and most effective. And we're hoping to do a little bit of that today with our two presenters from Arizona, or the three presenters we have today from Arizona and from King City, California. Next slide. As we move into our topic today, I want to first explore with you some of the ways in which transportation impacts housing stability. I think we want to go back one slide. No matter our age or ability, each of us needs a way to get from our homes to jobs, stores where we can buy necessities like food, to access health services, school, participate in education, recreation, and more, and to be socially connected. If we have a caregiver, they also sometimes need a way to reach us. Some people with disabilities, older adults, and people experiencing homelessness don't have a car or may be unable to drive, yet they still need to go places. Unless people with disabilities and older adults have accessible, reliable, and safe transportation options, their housing situation can become unstable. People experiencing homelessness also need ways to get food, health, and other services. Some have jobs that they may lose if they can't get to work. In fact, transportation and housing are consistently top reasons that people call the Administration for Community Living's hotlines, the Elder Care Locator, and the Disability Information and Access Line, or DIAL, D-I-A-L. In fact, last year, we received 29,000 inquiries on Elder Care Locator around transportation or transportation-related services, and 840 calls to DIAL for transportation or transportation-related services. These hotlines connect people with disabilities, older adults, and caregivers to information and services that promote independent living and address fundamental needs. Later in the webinar, we'll share those hotlines with you. Now we'll move on to the next slide. So as we move on to our topic today, I want to introduce our federal partners that are with us today. So our first speaker will be Danielle Nelson. She's a senior transportation analyst at the U.S. Department of Transportation. And after Danielle will be Erica McFadden, who is the director of the Office of Independent Living Programs at the Administration for Community Living. I'll turn the mic over to Danielle.
Thank you, Lori. Appreciate you all hosting today's webinar and making today possible. As Lori mentioned, I am from the Federal Transit Administration, or FTA for short. And as Lori mentioned, I'm in the Office of Program Management. I also meant to thank the Housing and Services Resource Center for hosting today's webinar and arranging today's speakers. I am very much looking forward to hearing from the local perspective in a little bit. I also want to thank all of my HHS partners for their leadership on this important topic and for recognizing the value of transportation in cross-sector collaborations. And as Lori mentioned later on in today's webinar, I'm going to be sharing with some of you that answered on the poll that you're not yet partnering with transportation. There will be a live demo of a tool to help you find some of those potential partnerships in your communities. And you came today, so you probably already know how important transportation is to everyday life and how it allows people to get to essential services. Our mission at the Federal Transit Administration is to improve America's communities through public transportation. At the core of what we do, FTA for short as we're called, we work to ensure the safety of riders and provide resources to public transit agencies so they can operate that service. And the enactment of the bipartisan infrastructure law included a significant increase in funding for public transit, much needed and very welcome funding. And FTA invests more than $12 billion annually to support and expand public transit. So we at FTA support transit systems serving both large and small urban areas, as well as rural agencies and tribes. And that tool I'm going to show you a little bit later really shines a light on some of the best kept secret, which is our rural public transportation, as well as tribal transportation that we fund. We provide funding to more than 3,000 transit systems across the country, including 1,800 of those providers who are in rural and tribal areas. So again, I look forward to showing you the mapping tool a little bit later, so we can show you exactly where those 3,000 FTA grantees are located across the country, and how, if you're interested, you can find them, as well as their contact information, if you're interested in starting up transportation partnership opportunities. And before I turn it over to my HHS colleague, I just wanted to share a very recent study that was published that's all about partnerships. So the National Academies, the Transit Cooperative Research Program, just published, the title is Partnerships for Equitable Pandemic Response and Recovery. I'm going to put it in the chat in just a moment, but this publication underscores the non-traditional ways in which organizations, many of whom are both HUD and HHS grantees, like the ones represented here today, how they partnered with our FTA grantees at the local level, so local public transit agencies, during COVID, to meet community needs and support equity goals. So some of the highlighted partnerships in this publication are innovative partnerships that included food delivery, supply delivery, transporting homeless veterans to medical care and vaccination sites, and providing internet and Wi-Fi access for remote communities that needed to access work and school, etc. So with that, I would like to pass things over to my other HHS colleague, Erica McFadden. Erica?
Thank you, Danielle. And thank you for that great introduction. I think we all know how difficult it is to locate accessible and affordable housing as well as transportation. I mean, from the looks of everybody here from across the country, it's exciting to see you all here. We all know it's a huge need. And we know that medical transportation is important, but we also know that transportation goes beyond that. You know, people with disabilities and older adults, they want to be included and engaged in their communities. They want to be able to shop, go to church, visit friends, go to work, and live lives they want like anybody else. Essentially, reliable and accessible transportation allows people the ability to live the lives they want to lead and to live safely and stably in the community. If they're able to access their community freely and that they feel safe in doing so, their housing stability is increased. That's why transportation continues to be a top concern in which people turn to disability and aging networks to help with resources and solutions. So specifically, I wanted to share information with you all regarding the role of our disability networks. I am part of the Administration for Community Living's Administration on Disabilities. It includes our protection and advocacy organizations, our state developmental disability councils, and our University Centers for Excellence in Developmental Disabilities. They all focus on housing and transportation as part of their work, and they're all located in every state and territory. But specifically, I wanted to highlight the Administration for Community Living grants for more than 350 awards for our Centers for Independent Living. That's the program I oversee. And the goal of these centers, they're run by people with disabilities, for people with disabilities, and their goal is to support independent living. They're the boots on the ground, serving people with disabilities of all ages and types of disabilities by providing information and resources, independent living skills training, assisting youth who have left high school, and helping move people out of institutions, among many other services to help people live the lives they seek. But like Lori said earlier with the dial calls, some of the top calls that centers get are around locating housing and transportation. In fiscal year 2021, SIL served about 237,000 people with disabilities of all ages. They provided 50,000 people with transportation services and about 53,000 people with housing services. And so specifically, if you want an idea of how centers work, one of the stories was from our center in Norfolk, Virginia. An older woman was starting to lose her vision and she needed to find an affordable apartment. So she met with the staff and they helped her connect her with support groups about her vision loss. And they also provided her a list of apartments that would allow her to utilize paratransit. They told her about paratransit, what it was. They helped her apply, and she contacted one of the places on the housing list, was approved, and now is living on her own and rides paratransit successfully. She doesn't see the vision loss as a loss because now she's part of a greater community and knows she can still live the life that she wants. Where there are limited options in housing and transportation, SILs are at the table advocating to expand these options. In fact, both the aging and disability networks are great partners in coordination as they're tuned in to the needs of the communities they serve. To address the need for transportation and housing stability for people with disabilities, older adults, and caregivers requires coordination at every level. It is a complex, wicked problem. And so recognizing the importance of partnerships to advance community living, ACL collaborates across Health and Human Services and with HUD and the department, the FTA, which Danielle was just talking about, to strengthen these partnerships that are needed at the federal, state, and community levels to coordinate housing and transportation for our communities. So today, you're going to hear examples of these partnerships that are going to showcase how they work together to be able to solve some of these problems. And Flagstaff, they convene people with disabilities, older adults, and community partners to develop a microtransit transportation service, which you'll hear about, that we're able to give people access to jobs, shopping, and other things that I discussed previously. And the second example is coming from King City, California, which I was told is the salad bowl capital of the world. So that's great. It's a rural area that built a partnership across community organizations to get funding and support to bring a rail stop with microtransit to King City. So these examples are going to highlight the importance of accessible transportation to support community living and how coordination with community partners like aging and disability networks make it possible. After all, emphasis on partnerships are essential for our work in advancing community living for all populations. Thank you.
Thank you, Erica, and thank you, Danielle, for this wonderful information and opening remarks. We're going to move now to our first partners who are on the call, and that is Estella Hollander, who is a mobility planner with Mountain Line in Flagstaff, Arizona, and Holly Krieger, who is the director of programs for the Flagstaff Shelter Services. Their organizations came together to form a partnership that provides necessary rides for individuals experiencing homelessness to connect them and others to the surrounding community. And I'll just note that Estella led one of our mobility on-demand projects for transit planning for all. So we're really pleased to have Estella here today and her partner, Holly, to tell us about their experience in Flagstaff, Arizona. I'll turn things over to Estella to get us started.
Excellent. Thank you, Lori. And I'll actually transfer it over to Holly to introduce the shelter.
Yeah, good morning. So at Flagstaff Shelter Services, we are a low barrier shelter providing shelter and housing resources to folks regardless of their faith, sobriety, mental health, criminal background, race, ethnicity, or gender identity. So we're really helping to shelter folks and connect them into housing resources. Our client population, we serve an elderly demographic, and we also have a large group of folks that have some mobility challenges. So in accessing services throughout the Flagstaff community, we partnered with Mountain Line to help in accessing those services for the clientele that we serve. So I'll go ahead and turn it over to Stella to talk more on that.
Excellent, thank you. And Mountain Line and the shelter have really partnered for a variety of years. They're part of our discounted pass program where we provide discounted passes. We also donated 2 paratransit vehicles to them to help with their services, but specifically this partnership was trying to fill a transportation gap in the Huntington industrial area in Flagstaff. It's really, I call it like a forgotten area in Flagstaff. There's a lack of sidewalks and crossings, as you can see from the pictures on here. It's kind of a low density area. However, there's a high concentration of human services. So the shelter is located here. There's also dialysis center, clinics. There's a food bank as well. So it's really an area that needs mobility options, but currently has no fixed route service. However, there is some fixed routes surrounding the areas, but it's difficult to access, as again noted, by the lack of sidewalks and crossings. But there's also railroad tracks to the north that are hard to pass, as well as Interstate 40 to the south. Next slide, please. And so this project really focused on inclusive planning. So bringing together key partners such as the shelter. We also brought together the county, our Council of Governments agency on aging, as well as some other important stakeholders, but also brought people who might be using this program. So we had older adults and people with disabilities part of the planning and implementation of this program. So really helping with those decision making. So throughout this project really helped, define the critical path items, but through the steering committee helped again with the decision making, figuring out, what this service will look like throughout the whole planning process. Next slide, please. And so some of the outcomes, so our project was a microtransit program, which is an on-demand service. It uses our paratransit vans, and actually this service combines the same vehicle for both paratransit as well as with this new microtransit. So could be that one, both riders are together in one vehicle. So some of the outcomes, so we, since implementation, we have around 600 trips. We did some rider satisfaction. It's high rider satisfaction, which is great. And about 63% of the riders are older adults or a person with disability, which were self-identified. And then focusing kind of from trips from the shelter getting to services. So 25% were to Walmart. This was really a key place in a key destination in this area to make sure that people staying at the shelter can get to Walmart, as well as medical care and other services, 16%. We have a connection center, which has basically 3 routes that come into this connection center. So then they can really get throughout all of Flagstaff from these routes. Around 28% of the rides were from there. And then the housing authority, which provides a variety of housing services, were about 5% of the rides. So really the purpose of this service was to really provide greater access to our fixed route, but as well as to kind of the surrounding area and kind of fill this missing transportation gap in Flagstaff. Next slide, please. And just lastly, one quick quote. This was from Sandra, kind of the first writer of this program, but she's 86 years old. I go to Walmart to get 1 to 2 weeks of groceries, and it's difficult for me to maneuver my cart on the regular bus. I love the $1 bus, as she puts it. It is easy to get my cart on there since there's more room, and the driver puts a lift down for me. And really, the people on there are very friendly, and the drivers are wonderful. She applied for paratransit, but did not qualify since she can still use the bus. So really kind of showing that this service is connecting people and kind of providing that gap to maybe for people who have some mobility challenges, but may not fully apply for paratransit. And that's it for me.
Thank you, Estella and Holly. If you'll stand by, we're going to turn now to Doreen Liberto, who is the AICP Community Development Director at King City, California. And Doreen, can you tell us about what's happening in California?
If you're talking about the storm, we're getting snow in our area, and I think that's what you're talking about. So an area where you couldn't go skiing, you can now go skiing. We can now use that as part of our tourist brochures. So yeah, great. We can go to the next slide, please, and I'll start. Good day, everybody. I'm going to give you a flavor of King City. It's a very small city, central part of California in Monterey County. As mentioned earlier, we are considered the salad bowl of the nation. Next time you have a salad or you eat strawberries, you can think of King City, please do. We are a rural small town of less than 14,000 people, less than 4 square miles. And we do have, it is a disadvantaged community. We have a number of people that are below the poverty line. And you can look at the demographics. A majority of the people are Hispanic, and a majority of the people who live there speak Spanish as their primary language. Median income is far below at almost $60,000 when you compare it to the US or California or Monterey County. We are a very disadvantaged community. Also, our households, we have a number of people that live in our households. Again, if you compare it to the US, California, Monterey County, we're at about 4.15, as opposed to the United States, or 2.6. So we have a number of people that are living within existing housing, a number of older people that are living in those conditions, and we are attempting to provide more housing and transportation choices. Next slide, please. Well, we have several projects we're working on. I do want to highlight one. There was old Highway 101 that went through the city. It was then diverted elsewhere, and a lot of the old 1940s, 1950 hotels are sitting there idly. And so we're now looking, if you look at the top slide, that will show you what the hotel looks like. The bottom one is we're starting to look at providing planning and housing and commercial facilities for our senior population. This is one that we're currently working on, that there'll be commercial below, senior facilities. In the rest of the facility, there is transit. We do have a program for mobility for all. This is close to grocery stores, close to other retail uses, and our historic downtown area. We got the next one. One project I really want to emphasize and talk about is the King City Multimodal Transit Station and the collaborative process we used. This is the area that you can see that we're working on to bring in or reestablish passenger service. We began this process in 2006. At that time, it was thought there was no way Amtrak or Union Pacific would ever allow a train to stop in King City again. But we said, let's do it. We need to provide some alternative transportation for this community. We need to look at what we do to reduce our greenhouse gases. We are a predominantly agricultural area. We identified that the military base close by, Fort Hunter Liggett, had a history with the city, that back during World War II, they took their troops on the rail outside the area. And so we start looking at, I'll go to the next slide, please. We want to look at the collaborative process. What do we do? And so the first thing we did, as I mentioned, we started earlier. In 2006, we found that there used to be a train that stopped in King City for passenger service in the 1940s. It ceased to exist. We said, let's do it again. Let's see if we can start it again. And I have to tell you, a lot of people laughed at us. They didn't think we could do it because we were this small, poor town, and there was no way that we could get Amtrak to stop there again. But we defined the project early on, and we identified the stakeholders, which was critical. One of the major stakeholders was Fort Hunter Liggett. This is the Army base of about 165,000 acres. They bring about 80,000 troops per year into that area. and they were using single occupancy vehicles to do it. So we reached out to them and said, let's build a relationship, and would you be willing to transport your troops again? And they said, absolutely. So early on, we brought a major stakeholder into our process. We built strong leadership, and our communication process was important. And that was, we decided that our elected officials would talk to other elected officials at all levels, that staff would talk to staff people. So we actually had this form of communication and strategic plan that we developed. We next identified what documents needed to be amended to incorporate this multimodal transit center. What do we have to change in order to get the state to approve this and provide us with funds? We identified funding sources and we applied for them as much as we could. And during this whole time, we kept the communication going and expanding our stakeholders. We finally got Amtrak to agree to stop. We received funding to work on the engineering design plans. And finally, after all this time, I'm happy to say in 2023, Union Pacific is reviewing our engineering plans. We had an opportunity, a collaborative meeting that included the state transportation department, as well as the chief deputy secretary for the rail and transit department, Amtrak, Union Pacific, 400 Liggett, all came together, and we're going forward. And the last thing I'll say, because I know my time is up, is don't give up. Whatever you do, keep going, and you will succeed in providing transportation.
Thank you, Doreen, and thank you, Holly and Estella. Holly, could you tell us why it was important for your shelter to pursue this strategic partnership, and what has been done? What has been the value added to your shelter and the people you serve?
Yes, this partnership was vital in connecting the client population that we serve to various resources in the community, specifically healthcare and housing resources. Those were the main ones. And it's definitely been able to help connect those folks into permanent housing solutions and helping end their homelessness.
Thank you, Holly. And Estella, could you tell us why it was so important to get the input from people with lived experiences, both in planning and once you were operational?
Yes, yeah, I think it's absolutely essential really to have a successful program. I mean, when planning a program, there's so many questions like what are the service times? What area? What are the key destinations people are trying to get to? What are some, how are people going to request rides, etc.? There's a variety of things that you have to figure out. And I think, oftentimes as a planner, it's very much this kind of high level view. So it's important to really get the input and feedback from people who might be using the program. Also helps gain that trust early on so that they can then be potential riders in the future. So we really did kind of a boots on the ground approach where we went to the shelter a variety of times, talked with the people staying there, asked them various questions of what are their transportation challenges, where are they trying to get to at what times a day, that kind of thing, to try and really create a successful program that are usable for the people who need the transportation services. So, and then once it's implemented, I think, again, figuring out the marketing tactics, that kind of thing, how are people getting the information and things like that. So it's really important to have kind of a steering committee or just a group of of people and champions throughout the planning and implementation.
Thanks, Estella. And Doreen, could you tell us, how did you work to overcome barriers with your partners? How did you get them to buy into the plan?
Well, I think the first thing, we had to have a clear definition and idea of what we were proposing. And so in our case, we knew we wanted to reestablish passenger service. And then we had to identify what our common goals could be with the other stakeholders. How can we add value to what you're doing? How would this project add value? So for example, 400 Liggett, they had 80,000 troops coming and going. They needed to reduce their greenhouse gas footprint under national law, and they wanted to reduce their costs. And so we talked about what value this would have. We could design a staging area for the troops to take the train, get off, save you a substantial amount of money, and reduce your greenhouse gas footprint. And so it was, again, getting back to it, clearly defining what the project is, looking for common goals with other stakeholders, and then showing how the project provides value.
Thank you. I'd like to just ask this question of all of you. One of the questions we get often is, how are these partnerships coming together? How do you keep them going once you get them started? And so what is the one thing, and I'll give you each a shot at this question. What is the one thing you would say was the most important in forming and maintaining the collaboration? Estella, do you want to go first?
Sure, I mean, really say listening to the people and then acting upon, what they're saying, really making meaningful change. I think that, again, creates trust. It makes people continue to be engaged. I think too often, in planning, you'll hear various complaints or criticisms or whatever it is like that, and then you just keep doing the same track. So I think it's important to listen, reflect, and make the appropriate changes and implement the possible changes if possible.
Thanks, Estella. And Holly?
Yeah, I would say definitely that collaboration and just looking at similar solutions that various agencies may have and kind of how everybody can serve the same kind of goal and purpose.
Thank you. And Doreen?
Our process has been longer, since 2006. And so it was really critical that we continue to communicate. I had mentioned that we had communication at different levels to make sure that the elected officials kept in contact with other elected officials, staff kept in contact with other staff people. Just keep the communication going, updating people about when we had a victory, in the sense we got funding or we overcame an obstacle. Really send it out to everybody, get them excited about the project, and just pushing it forward. And the one thing we found is that we couldn't depend on other agencies to do it for us. This very small city said, we need to do it. We need to push it forward. It's important to the region, to the community, and to our residents. And so I think just keep pushing it forward and maintain communication.
Terrific. Well, thank you, Estella, Holly, and Doreen, for this wonderful information and all your leadership in your communities and the work and the partnerships that you have going on. We're going to ask you back in a little bit here, but now we're going to shift. We'd like to ask all of you to respond to this question. What is the biggest success your state or locality has had in developing cross-sector collaborations that include transportation? And if you can put your responses in the chat. Again, what is the biggest success your state or locality has had in developing cross-sector collaborations that include transportation? And we're going to come back to Danielle Nelson here from the Federal Transit Administration to demonstrate a tool that they have. Danielle, we'll turn it over to you.
Hi, Lori. Thank you all. And I really enjoyed that presentation, especially because it leads perfectly into the conversation I wanted to share with you all today, which is the Federal Transit Administration, or FTA for short, funds several national technical assistance centers. The one I want to share with you today is our National Center for Mobility Management, or NCMM for short. And they have grant opportunities that they put out annually to help bring together partnerships like the one you just heard: housing and transportation, aging and disability, and the sky's the limit. So I just wanted to share with you the grant funding opportunities. So for example, they just announced, they haven't posted it yet because it's brand new, 3 of their ready to launch grants. So these are awards of $75,000. And I wanted to share with you, the next notice of funding will be out soon, but this is the one from last year that was just published. So one of them went to a rural part of Tennessee, Upper Cumberland region, and it's supporting a new ride to recovery program, and it has multiple partners. The other one is access to pop-up food distributions in rural Rockbridge County, Virginia. Also, a lot of really great partnerships for that one. And the third one is Rides and Smiles. And this one is suburban in Eastside King County. And this one is health and aging. And so I just wanted to mention there are funding opportunities through the center. But what I'm going to show you all today is this partnership tool, which is a great opportunity if you do not currently partner with your public transit provider. This is a resource that was developed by the National Center for Mobility Management. And so I mentioned earlier, there's over 3,000 FTA grantees. And if you're in an urban area, you can look on Google Maps and know when the bus or the train is coming. But when it's a rural transit provider or a tribal or our older adults and people with disabilities program, it's harder. It's not set, it's demand response. You've got to call, look on a website. So we developed this tool with FTA funding through this center. And I hope that you all will feel comfortable using it, because how it works, and I'm going to show you quickly, is you can type in the address of where you live, or you can zoom in. And as you can see, it's nationwide. But I want to be upfront. Each dot here doesn't show the service delivery. So what if we go to Missouri here? So you can zoom in here and you can see by looking at the area, the dot isn't showing a large service area, but where the headquarters is. So each dot represents a transportation service. The dot is placed either in the town or zip code or the headquarters location of that transit grantee. And so when you click on it, I just want to also share that sometimes there will be two options down here. So sometimes there'll be two providers in a community. So all you have to do is look at the bottom and notice if there is an option to go to the second page. And that's how you know if there's more than one provider in a community. And I also want to mention all of the data for this tool. It uses our FTA's National Transit Database. It also uses our National Rural Transit Assistance Program's Rural Database. Our National Aging and Disability Transportation put in all of the data for senior transportation and our older adult transportation. And it also, all of our state DOTs provided information as well. So it was a very collaborative effort. This just is released. It's a brand new tool. So I'm really excited to share it with you all today. And I also just wanted to share the opportunity for partnership. So if you were to go, let's type in, let's go to the West Coast. Let's type in Eugene, Oregon. So let me just make sure I'm spelling it right, because that would be embarrassing. And also, if I can use this tool, anyone can, because I am not tech savvy. So I wanted to show how, let's reduce this. So you can either click on it here and let's see. So in Eugene, Oregon, there's Lane Transit District. And some other things. It's always going to have the phone number of the service and the website, and then the website directly for fare information. And a best kept secret is that we require all of our fixed route transit to provide half fare, meaning you pay half of the cost of the fare if you have a Medicare card. So this will take you to that information. And this seems like a little bit of inside baseball, but each funding source, so whatever that transit agency receives, it shows here. So 5307, these are the numbers to the programs. So 5307 is the urbanized area program. 5311 is the rural program. And 5310, these are the formula programs. That's our older adult and people with disabilities program. And then other means they could get any of our other competitive grant funding. And so then let me take you now, let's also, let me just click on the website to show you what it takes you to if you want to find the transit provider. So it'll take you directly to the public transit provider, so you can plan your trip. You can learn more about the fares, riding, and it also has the phone number if you want to call them directly. It tells you what funding they receive. And so now let's go to a rural community. So let's now go closer to the East Coast. Let's go to Lost Creek, West Virginia. And as you can see, there are no dots, meaning there's no FTA grantee in Lost Creek. But if you zoom out, we can see there's dots around it. So looking here, the closest one is Clarksburg. So if you click on that, and if you go to their website, we can see here they receive Section 5310, which is the enhanced mobility. So this is senior service, specifically for seniors. But if you go to the next one, now this is the public transit provider that also does paratransit. And if you click their website, let's see if they cover Lost Creek. Because again, the pin is dropped in where the headquarters is, but it doesn't show the larger service area. So seeing right here, it does cover Lost Creek. It's got a very large service area. So that's how you can tell, even if there isn't a pin exactly in the community you're looking at, go one town over and you can see if it covers your service area. In this case, it does. So with that, I want to turn things back over because I know we really want to get to the questions, Lori, but I also really wanted to highlight that issue about half fare, because if you didn't know about it, I hope everyone leaves today with one thing, which is if there is fixed route transit in your area, You can ride it if you have a Medicare card for half the cost, half fare. So I live near Washington, D.C. And so if you click the Washington, D.C. area and you go to fares, right here, it says reduced fares. Some will call them half fares, but look for reduced or half fare, and then I'll tell you how to apply. And so in my community, you get a yellow Smart Trip card, which charges you only half the cost. So with that, I'll pass it back over to Lori, and thank you for the opportunity to share this resource.
And thank you, Danielle. And I'd like to just ask all of our speakers to come back and we'll take a few questions from the audience. There are a few that are pending out here. And so one of the questions that the audience has asked is, what were some of the barriers you faced in the process? And maybe we could go ahead and start with Doreen. Do you want to respond to that question?
I think one of the barriers that we had in the very beginning was the fact our demographics, that many people would say it's only King City, you didn't deserve it, you're a rural community. I think that was one barrier, this stereotype that people had, or that there were larger communities that deserved the funds more than we did. And quite honestly, we found that upsetting, because our citizens deserve transportation and housing as much as anybody. And I think in a lot of ways that motivated us too, to say we can do it. But that was one barrier that we had, that we are just a small rural community and the larger communities deserve the money, not us.
Thanks, Doreen. So no matter what your size, keep that passion going to drive
Absolutely.
to what it is you're looking for. Estella, were there any barriers that you faced in the process, and how did you overcome them?
Yeah, I think it's always hard with gaining and maintaining participation and getting, partners to be invested. So I think, finding those common goals, and like, again, with the shelter, they had challenges with getting some of their clients to the fixed route. And so I think there was a common goal of, they need transportation and we want to provide transportation in this area. But I think it can be challenging to get, just that maintaining that partnership throughout the years with maybe writers or with people who are participating in the planning process.
Thanks, Estella, and thanks for those tips on how to maintain those relationships. And Holly, how about from the shelter's perspective, what are some of the barriers that you faced in the process, and how did you overcome them?
Yeah, I think just getting the word out to the masses, and just keeping that engagement, and looking at new ways to kind of paint the picture of what we're doing in the collaboration behind the Mountain Line Microtransit. So yeah, just continuing to promote that and get that out to the folks that are accessing those services.
So helping the people stay aware of what's available and getting them connected. Thanks, Holly. And then Danielle, there's a question here for you. Does the partner locating tool have a way to filter for transportation that is available to the general public, rather than just those that serve people with disabilities or those experiencing homelessness?
Yes, it does. So it has the listing there of who it serves. So it'll say seniors at the top, or it'll say paratransit. And then it does have by funding source at the bottom, sort of reiterates who it is for. So if it's Older Americans Act Title 3B services, it'll say seniors at the top and have that funding source listed. So yes, to an extent.
That's great. And I think then the other piece is that there are some social service organizations that serve a lot of people. And so they're looking to maybe use some of these tools. It sounds like, Danielle, the tool you have, the transportation provider tool, might be a good tool to use.
Absolutely. It's why we asked for our center to develop it, because there's a need to find transportation, and it was just released. So it's now being updated. Eventually that'll show service area in a grayed out box rather than just a dropped pin. So we're looking at ways to improve it and make it a more useful tool. But the goal is to help people find sometimes the best kept secret, which is rural public transit and other opportunities to connect with our grantees. So that's the purpose of the partnership tool.
Terrific. They're also asking whether the website has information available in multiple languages, Danielle.
That's a great question. I would have to ask my, I'll reach out to Amy Conrick, who's the director of the National Center for Mobility Management. I don't believe there currently is, but there may be an opportunity to have it translated into other languages. So I'll follow up with you, Lori, about that.
Okay, that's great. And then I have one more question. And this is open to everybody. Doreen, you might be able to weigh in on this one. Could you describe some potential paths forward for a small city, 40,000, that does have a small bus system? However, the routes are only served during limited hours. Is there an example of a region, city, town that got FTA funding partnerships to extend an existing service to later in the evening? This community service ends at 5:45 p.m., so it curtails movement of residents who do not have cars and prevents them from taking jobs in the late evening. And Danielle, you also may be able to respond to that.
So is the question, do FTA grantees who are extending service outside of normal service hours, is the question, is that an option?
I think that's an option. And then also they're asking for some potential paths forward. So I thought maybe Danielle, you could respond to the FTA piece, and Doreen, you might have some ideas too.
I'll just mention, if you're interested in having those conversations with your local public transit grantee, the National Center for Mobility Management, they have a phone number on their website and an email. They can help to initiate those conversations. Of course, funding is a challenge, so it's always great to have other partners, whether aging, housing, et cetera, coming to the table to help. We allow federal fund rating, so other non-DOT funds used as local match to 3 of our formula programs. So these type of partnership opportunities are a wonderful conversation. So I would just say contact the National Center for Mobility Management to have a conversation specific to your community, because it is eligible. The question is just how to extend the service to be most useful to the community and how to fund it.
And I'll add that we are a small community, and of course we partnership with nonprofits and also religious institutions. And so we do try to build a collaboration of government, private, nonprofit, and try to set up something that if people do need transportation in the evening, it is arranged. We do have mobility for everybody, but we do put out something that we do have a network with all the nonprofits and seeing if maybe we could provide transit in the evening for people. And then also go after some additional transit funds through our regional transportation agency for evening service.
Thanks so much. And Estella, I don't know if there's anything, Estella and Holly, that you would add to that question?
I think it's always just think outside the box. Is there like a taxi company that can maybe provide the rides? Is there Uber or Lyft? I know, and maybe Holly. I think there is some sort of late night program that the shelter has partnered with. But yeah, I think just see what all the options are in your community and see if there's ways to partner.
And I have to tell you all, you're all sending some really great questions here. Erica, I think one of the questions that's come in too is like, how do you find the disability and aging partners? Is there anything you might add to help transportation providers find their counterparts?
Yeah, they can contact, if they ever feel like they don't know who they are, they can contact us here at the Administration for Community Living. We can connect them to who they need to go to. There's also Dial. Dial is also a resource for everybody to use. So if you're looking for who they are in your community, we have that awesome hotline to use as well. So you can contact us or Dial and we'll help connect you to the right people.
Thanks, Erica.
Lori,
Oh, go ahead, Danielle.
Bill Wagner, who also works on the National Center for Mobility Management, is here. And I saw you put in the chat, so thank you, Bill. They do one-on-one intensive technical assistance and regional forums. So thank you, Bill. Shout out for putting that in the chat. They are an excellent resource. So if you, and also I saw US Aging, who's a partner on the National Aging and Disability Transportation Center. They also provide free one-on-one technical assistance to communities. So I just want to say, Estelle, thank you about thinking outside the box and encouraging those partnerships. If you need a little extra assistance, those TA centers are there, free resource to help.
Those are all wonderful, wonderful resources to be sharing. And I want to thank our panelists again and our speakers for today. we do have more questions than we had time to get to, but we want to keep everybody on time today. So the speakers will review the questions and provide responses. We'd like to, before we move on to the closing, again, just share these additional resources. The Elder Care Locator and Dial help older adults and people with disabilities and caregivers learn about transportation resources. As we mentioned earlier today, transportation is the most frequent inquiry to the Elder Care Locator, along with housing. And the Elder Care Locator is a national service of the Administration for Community Living, and it is they received 29,000 calls, as I mentioned earlier, in 2022 for transportation. Their call center hours of operation are Monday through Friday from 8 a.m. to 9 p.m. Eastern Time. The website is ELDE chat that's available too. The Disability Information and Access Line, or DIAL, DIAL, can be reached at 888-677-1199. That is supported with funding from CDC and ACL. And in addition, the DIAL call center can also assist and help people with disabilities access independent living resources, such as connecting to their local center for independent living. DIAL received 840 transportation-related calls in 2022. IAL, and you can chat, text, or video phone is available. You can also email DIAL at DIAL, the @ USAGINGANDDISABILITY.org. We'll go into the next slide. A big thank you to.
Can you repeat that email address for DIAL?
Sure can. The email address for DIAL is DIAL, the @ USAGINGANDDISABILITY.org. And American Sign Language is also available on DIAL. Next slide. A big thank you to all of our presenters for giving us such valuable insight into the role that transportation plays in connecting housing, aging, and disability and health partners. We hope that through the discussion, you've gained some insight into ways to collaborate with transportation partners in your communities, and for transportation partners to be collaborating with the housing, disability, aging, and healthcare sectors. We've all heard opportunities on things we can act on, so we want to encourage you to use the Housing and Services Resource Center as a way to get connected and learn more about the different resources that are available. The next slide. The HSRC team is very excited to feature another webinar on cross-sector partnerships on April 18th. We'll be focusing on partnerships with continuums of care, serving the growing population of older adults and individuals with disabilities experiencing or at risk for homelessness. If you can register, please register today to get notices about this upcoming webinar. And I'd like to, on the next slide, just ask if you could all please take 3 minutes to answer our short feedback form. Your feedback is really important in helping us improve these webinars to really make them most effective for you. And the HSRC is your resource center, so please email us at hsrc@acl.hhs.gov about your technical assistance needs, website suggestions, and tell us about your own cross-sector partnerships. We're always looking to highlight successful partnerships that are out there and help people share stories. And finally, we want to thank Mission Analytics, US Aging, Emily Stiles, our ASL interpreter, and Serena, our CART specialist, for their roles in producing today's webinar. And especially, we're grateful for everyone who's joined us today. Thank you for your questions, for sharing your partnerships, and thank you again for all the work you do to help people stay stably housed and help those that are homeless get housing and transportation, live full lives in the community. Thank you and have a good afternoon.